Looking ahead, what do you think are the lessons we can learn from the pandemic so far in terms of helping the public understand what the Chief Medical Officer of Health does, or improving communications so that it is more clear what decisions are political and which ones are being made for public health reasons?
Well, I think there are two things that going forward I think are going to be important to see how well we address after we're through with COVID. One is that, as Joel mentioned, the position is very precarious. And it's precarious for two reasons. The first is that you're constantly having to speak truth to power, whether it's an important business person or an important minister or even the premier themselves. And sometimes power doesn't like to have the truth told to them. And my experience, their natural response, which is time honored, is to shoot the messenger. And so you're in, as a chief MOH, you're often in very difficult situations. And what makes that more precarious is the fact that you have virtually no protection. So if I were a full professor in a university, I would have far more protection than any chief medical officer health in the country. And so if you really want to get to guarantee that you're getting good, objective, unbiased, reliable, accurate information that you can trust, it would help if the chief MOH wasn't in such a precarious position.
We get noticed when there's a disaster or an outbreak or something, but it's really the underlying resilience that is going to be most important in the long run. I'd like to see, as we go forward, more transparency, more clarity, and more accountability. I think it would be better if governments and others were willing to be more transparent about the decision-making issues, the uncertainties, the difficulties, the fact that the advice from a chief medical officer of health might be different from the advice of the director of an intensive care unit or a family doctor or a nurse or a teacher, or a minister or a priest. I mean, there's just so many domains of society that have something to say about what's happening. And so I'd like that to be more transparent. I'd like that, and I'd like the data and the reasoning for the things we're being told to be more clear. Often it's just sort of a repeated statement of what we have to do, and the numbers are going up because we're failing to follow the rules, and now the numbers are going down because we're succeeding in following the rules. Those are very simplistic things which actually are quite complex in analysis to determine what's actually happening and what's actually working and how much is the natural process, etc. So, yeah, more openness, transparency, and accountability for the decisions.
So would you like to see, for example, all of the recommendations that a chief medical officer of health makes, whether or not the government chooses to follow them?
So I would. Now, this is such a good question, because when you're working in this job and with government, there's this minister's privilege. You are not supposed to disclose openly what advice you've given to the minister or what the minister has told you. That's privilege. And I'd like that to change. I'd like governments to be more confident that the advice they were given was this, and they took into account other considerations and had to decide something different from what the public health doctor was advising, which is, I think, perfectly reasonable. Whenever I was challenged with that by the media and said, well, we don't think the minister or the premier is doing what you would have liked them to do, I would say, well, of course not. I'm just providing one input based on my expertise. They've got many other things to consider. And I think that's how it should be. Yeah, I would love that transparency to be at least tolerated, if not encouraged. I think coming back to the trust issue, that's where the trust really gets built.